Hi, I'm Praveen Gautam, your trusted dental advisor. I'm right here with Dr. Michael Sernik, communication guru. Good day, Michael.
Hello, Praveen.
Yeah, welcome to the show. Yeah, we are just here with our viewers, and one of the questions they are asking or always on top of their mind is, Praveen, look, interesting time, yeah, they want to know a little bit about the insights. Yeah, what they can do in this in a difficult time, something like this. Yeah.
Okay. I'm not sure if we're in difficult times just yet, but I do hear that some people are worried. They've had some very good times, but
Yeah.
they're worried if it's going to continue because we hear about interest rates going up.
Yeah.
Maybe the economy will be affected. And so some dentists are looking forward to what strategies should they implement now so that they're sort of like ahead of the curve
Yeah.
rather than trying to react later because they've been through ups and downs of business in the last 5 years. And having recognized that, they want to, I guess, protect themselves against possible downturns, which could happen because if we've had an upturn, usually it's followed by a downturn. So if you're asking me, what would I say to these
Yeah,
practices?
please.
Okay. Look, I think that we go back to some basics. First of all, dentists very often, if they're nervous, it shows. And so their communications can look a little bit like that they're uncomfortable or they're trying to talk the patient into something. The bottom line is I think that if we think about how does dentistry get affected in bad times, we want to be able to keep patients, have them continue to come to the practice. And I would be focusing very much on preventive care and treating it a little bit more strategic. In other words, if a patient comes in and we see some calculus on the lower front teeth, very often we'll say, oh, you need to see the hygienist or I'll clean that up for you. And they do that. And then later on they tell the patient, there was some stuff there and, you should come back. So if I wanted the patient to come back, I'd be taking a photo initially directly of that topic.
Okay.
Take a photo of that before you clean it off.
Right. Right.
You can take photos afterwards, but
Yep.
the most important photo is the one before because
Yep.
it shows a problem.
Yes.
And then you can explain all the things that you would do. I won't go through that now. The dentist knows what to say. But my point is I would be trying to get the average patient who
Yep.
doesn't require a lot of treatment to come back regularly in order to
Yes.
prevent problems. Because as long as the patient's returning regularly,
Yep.
chances are they're not going to have to pay a lot in order to keep up with things, but because they're preventing problems.
Yes.
And I'd make that message very clear to the patient. And they would then have the expectation that this is like an insurance policy for
Yes.
them, that they come back regularly, don't
Yep.
miss those appointments in order to not get into problems later. Because if they hold back on coming and then problems accumulate, and then suddenly they're stuck with an expensive problem at the wrong time,
Yep.
I think that would be the type of message that I'd be focusing on. So again, getting patients to come back for routine things rather than to be, I guess, focusing too much on the expensive dentistry if the patient seems to be nervous about their current economic conditions.
That's a great insight, Michael. So what you're saying is bringing retention in the patients, and obviously you touched on about the oral care, so preventative more than fixing the stuff, right?
Yeah, so you're not scaring the patient. You still have to do what you have to do, but perhaps focusing on the preventive side more than you might naturally do so. And I mean, people want cosmetics, but when things are tough, cosmetics become secondary. And what we're really trying to do for a typical family with kids and all the rest of it is to come back regularly in order to maintain conditions, in order to avoid catastrophes and problems.
Thank you so much, Michael. Great insight here. I hope you enjoyed the great tips from Dr. Michael Sernik. Thanks for watching, and we'll see you in the next one. Bye for now.